Hello, I'm Professor Luk Rombauts, Medical Director at Monash IVF Group. In this video, I'll try to explain what endometriosis is, how it is diagnosed and treated, and what it may mean for fertility. Endometriosis is a chronic condition where tissue that is similar to the lining of the uterus actually grows outside the uterus. And this tissue can be found on the ovaries, the fallopian tubes, and other pelvic organs. The tissue is primarily composed of what we call glandular cells and stroma, the supporting tissue, and they mirror the structure of the uterine lining. These cells respond to hormonal changes during the menstrual cycle, causing them to thicken, to break down, and to bleed outside the uterus. And that leads to inflammation, scarring, and pain. So what causes endometriosis? The exact cause of endometriosis remain unknown. However, there are several factors that are believed to contribute, including genetics. Research has demonstrated a familial predisposition where individuals with affected family members like your sisters or your mother are at higher risk. Hormones. High levels of estrogen appear to promote the growth of endometriosis. Immune system dysfunction. Issues with the immune system may indeed prevent the body from recognizing and eliminating endometrial-like tissue growing outside the uterus. Endometriosis primarily affects individuals of reproductive age, most commonly between the ages of 25 and 40. The most common symptoms include chronic pelvic pain, often worsening during menstruation, dysmenorrhea, that means severe menstrual cramps, pain during or after sex, painful bowel movements or urination, and finally also infertility, due often through anatomical distortions or inflammatory changes. Pain is considered really the hallmark symptom of endometriosis. It may be described as a deep aching sensation, often cyclical in nature, and peaking just before or during periods. Importantly, the severity of symptoms does not always correlate with the stage of disease. Diagnosing endometriosis can be challenging due to the variability of symptoms and also their overlap with other conditions. The process often begins with a detailed medical history and a pelvic examination. Imaging tests such as an ultrasound or an MRI can help identify cysts associated with this condition, which we call endometriomas, but also deep infiltrating lesions that we call nodules. The gold standard for diagnosing endometriosis remains the laparoscopic surgery. During this procedure, a surgeon views the pelvic organs and can biopsy any suspicious tissue. This allows for a confirmed diagnosis and in some cases also simultaneous surgical treatment. Endometriosis can significantly impair a person's ability to conceive, with we estimate around 30 to 50% of diagnosed individuals experiencing infertility. The presence of endometrial-like tissue outside the uterus may distort the pelvic anatomy, interfering with the ovary's ability to release eggs. It may block the fallopian tubes, or it could affect the implantation of a fertilized egg. Despite these challenges, many individuals with endometriosis can still conceive with appropriate treatment. Management may include laparoscopic surgery to remove the endometrial implants and adhesions, or the doctor may choose or advise assisted reproductive technologies, such as IVF, which can bypass many of the issues caused by scarring and adhesions. Treatment plans are always tailored to the individual needs, the severity of the condition, and their reproductive goals. If you suspect that endometriosis may be affecting your health or fertility, seeking medical advice and exploring your treatment option is an important first step. Early diagnosis and a tailored treatment plan can significantly improve both quality of life and support your fertility goals. Thank you for watching. And if you'd like to explore your treatment options further, feel free to request a complimentary nurse chat or book in to see one of our many specialists at Monash IVF.